Saskatchewan will soon get $61 million to address immediate issues, including backed up emergency rooms and long surgical wait lists. The health minister says that number sounds high, but it's not high enough.
When you're talking about the healthcare budget, when we're averaging about $20 million a day that we're spending in the healthcare budget, this isn't going to move things dramatically.
Still, Saskatchewan physicians say any money is helpful, especially if it helps reevaluate the current primary care system.
I would, in a nice way, blow up the system and redesign it into a team-based care model, which is what the National College of Family Physicians also envisions in their patients' medical home. And so that's really where we want to go with any new money.
Mueller says in order to transition to a team-based care model, which would spread out the workload, the way doctors are paid also needs to be changed.
You do want to have more members on your team that can help provide care to a patient. Many patients have complex care needs, but not necessarily all of those needs need to be addressed by the family physician.
Meanwhile, a medical clinic owner says he has 3 doctors on staff, but 2 might leave. He says money needs to be put into recruiting doctors.
I've seen at least 20 that I know who are gone now, and that's just in the past, let's say 6-7 months. Warman has no doctors except the ones in our clinic. The recruiting has been done specifically and singularly by us alone.
Murray says he's asked to be reimbursed for those recruiting costs, but hasn't gotten an answer from the province. The Saskatchewan Union of Nurses is also weighing in about how the money could be used.
If we don't retain the late to mid-career nurses, it won't matter how many nurses that we bring in, whether it's brand new grads or the nurses coming from the Philippines, they aren't going to stay because they don't have anyone there that's going to mentor or preceptor them in.
Saskatchewan's healthcare minister says the first injection of federal cash will be used to help the government continue its work to address the overloaded system. Any new plans will be revealed when the budget is released later this month. Laura Sharpaletti, CBC News, Regina.